share about our system's efforts around COVID-19 vaccination. Our DHS efforts are focused on vaccinating our own employed and contracted workforce members, vaccinating our impaneled primary care patients, many of whom are uninsured. We have nearly 500,000 patients across over 30 sites in LA County. We are also vaccinating eligible patients in the following settings: inpatient psychiatric units, inmates through correctional health services, the Office of Diversion and Reentry patients, and housing for health patients. I will provide some background on our approach to rolling out the COVID-19 vaccination in our staff and patients. Like other healthcare providers in LA County, DHS is receiving vaccine supply from DPH and administering vaccine according to their recommended phases and tiers. According to the CDC, the California Department of Public Health, and LA Department of Public Health guidelines, DHS started by first vaccinating our Phase 1 healthcare workers beginning on December 18th. We prioritize the order of staff vaccination based on exposure risk due to work setting, type of work, and whether the staff member had personal risk factors, placing them at increased risk of severe illness. As of today, over 18,500 DHS staff have received their first dose, and over 16,000 have completed their second dose. Now for our patients. We began vaccinating our patients on January 21st, and currently have 12 vaccine sites set up across the county, all the way from Long Beach up to High Desert. Several sites are offering Saturday appointments, and one site has offered drive-through appointments. As of today, we're pleased to have vaccinated over 12,600 patients across our DHS sites. Depending on the vaccine supply DHS receives each week from DPH, some of our sites are administering the Pfizer-BioNTech vaccine, and other sites are administering the Moderna vaccine. We started our first wave of second dose injections just this week. Our DHS approach to vaccinating patients has included prioritizing our age 65 and over patients, and also outreaching to our patients who are healthcare workers, specifically in-home support services home care workers. We are outreaching to our patients about the availability of the vaccine in a number of different ways. Our strategy includes our clinic and call center staff calling patients in these target groups directly by phone to offer the vaccine and schedule. We're also using automated robocalls for high volume outreach. Each week, we have sent messages via email and text to all our patients, informing them of vaccine rollout and asking them to call if it is their turn to schedule an appointment. We've also been receiving incoming phone and email requests from our patients for vaccine appointment scheduling. DHS has also set up several other ways that patients can get more information about the vaccine. We have a COVID-19 nurse advice line set up since the beginning of the pandemic to help answer our patients' questions about COVID-19 disease and the vaccine. Our My Wellness patient portal website has also been updated to include vaccine information. And the DHS website, dhs.lacounty.gov, and other social media platforms like Twitter have vaccine information. Our overall goal is to vaccinate as many of our DHS patients as possible against COVID-19 to help fight this pandemic. In order to ensure that our patients are able to get to their vaccine appointments, transportation can be arranged through health plan resources by our clinic staff. And for our uninsured patients, DHS has made arrangements through Uber and Lyft to offer rides to vaccine appointments. Patients can access these transportation resources by asking about them when they make their vaccine appointment, and we will connect them with our social work staff to assist. I've shared with you about what we've done as a health system at DHS in terms of the vaccine rollout, and now I'd like to share a little bit about my own experience as a primary care provider, seeing firsthand just how excited many of my own patients have been to receive the vaccine. I remember so clearly the first day we offered the vaccine and my very first patient who was scheduled. He's a 70-year-old gentleman who has survived 3 cancers, and he had been emailing me every week since December when he heard the vaccine might be rolling out to ask when he could get it. And I told him we would let him know. And the first day in January when we were offering it and he called, I was excited to be able to say, yes, this is your turn, this is your time, and we will schedule you. And it turned out that the day that he got his vaccine was his 70th birthday. And he said it was just the best birthday gift ever. Our DHS population is diverse, and my patient panel reflects that. Most of my patients are Spanish speaking. Many of them have been vaccinated. One of my Korean patients called the very first day the vaccine was available, and I was so pleased to be able to schedule them. Yesterday, I scheduled an Arabic speaking patient with a phone interpreter for their vaccine. And just this morning, one of my Filipino patients that I spoke with who has cancer and diabetes told me just how happy and relieved he is to be getting the vaccine with us. For my own patients, what I had been doing during the months leading up to the vaccine rollout was to promote and talk about the vaccine at every possible opportunity, especially for my older and high-risk patients, so they were ready to schedule the vaccine when they heard the news that the vaccine was available. I think it's important for all of us in healthcare to promote the vaccine with our patients who trust us. In closing, I want to encourage everyone to get the vaccine when it's made available to you. And I especially want to ensure that all of our DHS patients are aware that the vaccine is available to them through our clinics at no cost. We will continue to outreach to our DHS patients as they become eligible for the vaccine. But if they haven't heard from us, they should call their primary care provider to inquire and schedule. I want to thank our partners at DPH for their tireless work leading LA through this pandemic. We are grateful to be able to bring the COVID-19 vaccine, a valuable and life-saving service, to our patients, furthering the mission of DHS. Thank you.